What happens when a woman comes for MTP? We always do a scan to confirm the pregnancy location, and the second thing we do is a couple of blood tests which includes your hemoglobin level, which is more important. When you take the MTP pills, you might land up having excessive bleeding and cramps, by which your hemoglobin might fall very often. The next thing we want to look up is your blood group, because if you are a patient with a negative blood group, we would like to give an anti-D injection for you post MTP, because it should not cause any further problems in your future pregnancies. This is especially effective when your husband is positive blood group and you are a negative blood group. So when you come up for an MTP, we do these tests, we give you a pill schedule and you have to follow that schedule, and depending on your symptoms, we decide the number of doses required for you. And if you are going in for a pregnancy more than 10 to 11 weeks, you might land up having a DNC sometimes because of the implantation problem. Once you finish your MTP schedule, we would call you back for a review scan after 15 days, and we would like to check for the retained products of conception. If there are no retained products of conception, you can lead a normal life. You will get back your normal periods within a month or 45 days. And if you have an RPOC, depending on the size of the RPOC, that is retained products of conception, we would like to advise you if you require further medication or a DNC to go further. DNC is not the first resort to do a termination of pregnancy. So we can always go with the pills first, especially if it is your first pregnancy. But if you are a patient who had a previous cesarean delivery or any other issues or scars in the uterus, like if you had undergone a fibroid surgery or any other surgeries on the uterus with a scar, there might be chances of implantation of the pregnancy on the scar. So directly we would be suggesting you a DNC for it rather than giving a medication. Because if you take medication, that might lead to your scar weakening and opening up of the scar. Please consult a physician while you are planning for a medical termination of pregnancy to decide the management required for you and appropriate for you.